Good day, ladies and gentlemen. We are group number 6, and today we are going to be discussing about our second laboratory exercise concerning mycology, human fungal pathogen, with our chosen fungal disease called mycetoma. But first, let me introduce to you what fungi are. In accordance with Microbiology Society, fungi are defined as an organism that can be single-celled, but is usually seen as a eukaryotic, complex, multicellular organism. They reproduce both sexually and asexually. Fungi are found in just about any habitat, but are mostly seen living in the mainland such as the soil or in plant materials. They are classified as heterotrophs, which means that they do not have the ability to create their own food, thus feeding on other organisms. Fungi also play an important role in the ecosystem as a decomposer and can also be highly parasitic to plants, animals, and humans. The study of fungi is called mycology. Some types of fungi are known to cause fungal diseases to humans, such as a ringworm, thrush, and athlete's foot. The fungal pathogen that will be highly focused upon in this paper or report are the fungi that causes the fungal disease called mycetoma. This is defined by the World Health Organization as progressively destructive, morbid, and chronic inflammatory disease that is found in any infected part of the body, usually the foot, which can be caused by certain bacteria and fungi. The principle behind fungi, characterized also as a disease-causing pathogen, are given immense emphasis through this paper. Importance of studying fungi as a disease-causing pathogen is to raise awareness and knowledge of the pathogenic fungi and effects of these to humans. Objectives of such paper include application of medical mycology through the study of a fungal disease and enrichment of knowledge about the chosen disease's characteristics, causations, signs, symptoms, diagnosis, and treatments. Given objectives are all achieved through immense research and study about the chosen fungal disease known as mycetoma. Dissection of relevant and accurate information are sectioned in this paper or report for easier comprehension. Let's move on to the next.
The materials that were used in completing this paper are mostly laptops, phones, and the internet. The objective of this paper is to educate the students regarding the concept of human fungal pathogens, which also includes its manifestations, preventive measures, diagnosis, and treatment. The students were required to identify and study the fungi which cause the disease, mycetoma. The students utilized their materials such as laptops and the internet in order to determine the causative fungi of the disease mycetoma. Furthermore, the students extensively studied the symptoms, sources, risk and prevention, diagnosis testing, and treatment. The students mostly obtained the data needed through searching the web for valid references. Lastly, the results and findings were gathered and converted into a PowerPoint presentation. The figures that will be shown are the most common fungus found in mycetoma. So first is the Madurella mycetomasis. For the second figure is the Trematosphaeria grisea, or formerly known as Madurella grisea, and Pseudosporium aposporium, asexual state.
Mycetoma is a severe, progressive local fungal disease which involves upper extremities, back, and feet. The most common bacteria that causes mycetoma are Streptomyces somaliensis, Nocardia brasiliensis, Actinomycete maduri, and Actinomycete pelletiera. For fungus, the most common are Madurella mycetomasis, Trematosphaeria grisea, formerly known as Madurella grisea, and Pseudosporium apiopsermum in asexual state, or Pseudoleuceria boydii in sexual state, teleomorph. The disease progresses to a nodule that hardens and forms sinus tracts that discharges pus and grains filled with organisms. This affects the underlying bone, tendons, muscles, and joints. Mycetoma can be initiated by bacteria or fungi. According to the Center for Disease Control and Prevention, this disease is frequently diagnosed in Africa, Mexico, India, and places that are located near the equator, and places that have dry climates.
Before we proceed, I'm just going to show to you a picture. So as you can see, a woman has swollen legs caused by mycetoma.
For the symptoms, according to the Center for Disease Control and Prevention, the symptoms for both bacterial and fungi mycetoma are similar, which is a painless lump under the skin. However, the bacterial mycetoma or actinomycetoma tends to be more destructive and invade the bones earlier. According to Rivero, mycetoma usually starts as a swelling on the exposed part. The affected area is hyperpigmented and has a normal temperature. After time, the masses start to grow larger and discharges fluid that contains the characteristics of the grains. The pain starts to worsen after a period of time and can cause destruction of the underlying bone and muscles.
According to the Center for Disease Control and Prevention 2020, the common people to be infected by mycetoma are those who have a low socioeconomic status and manual laborers, such as farmers and livestock herders. Health experts advise that people who live in an endemic region should not walk barefoot as this protects the feet while working outside. Early detection and treatment of the mycetoma can reduce the casualties from the mycetoma and can cure the condition. Early detection and treatment of the mycetoma can reduce the casualties from this disease and can cure the condition.
For the sources, countries like Africa, Latin America, and Asia are known as the mycetoma belt. This includes the Bolivarian Republic of Venezuela, Chad, Ethiopia, India, Mauritania, Mexico, Senegal, Somalia, Sudan, Thailand, and Yemen. In Africa, the most common type of mycetoma is fungal mycetoma, or also known as eumycetoma. While in Asia and South and Central America, the most common type is bacterial mycetoma, or also known as actinomycetoma. This disease primarily affects poorer countries that have enough exposure to the risk, which is exposing skin rupture to contaminated water or soil over a long period of time.
The diagnosis for mycetoma is grounded on clinical presentation and identification of the causative organism that can be distinguished by examining the grains that are discharged by the sinuses. According to the World Health Organization, it is important to culture the grains to classify the organism that caused it. Other useful techniques to diagnose mycetoma include DNA sequencing and imaging techniques such as X-ray or ultrasound. With these tests, a physician can determine how much damage has taken place in the infected area. According to WHO, the most accurate method is identification by polymerase chain reaction.
The treatment for mycetoma depends on the type of the causative organism, whether it is caused by a bacteria or a fungi. The treatment for bacterial mycetoma requires a use of antibiotics, and surgery is not needed. However, for fungi mycetoma, it requires long-term antifungal medications, and sometimes it is not completely effective. Thus, surgery and/or amputation of the infected part is needed to cut away the infected tissues.
For the results and discussions, The results indicated in this paper are based on the case series of Cardenas del Garza et al. 2020. Regarding the clinical characteristic and treatment of actinomycetoma in Northeast Mexico, 31 patients diagnosed with actinomycetoma by direct grain examination, histopathology, culture, or serology from January 2009 to September 2018 are involved in this case series with a male to female ratio of 3.4:1. Figure 1 shows that the most causes of lesions in patients that are diagnosed with actinomycetoma are nocardia brasiliensis with 83.9%, followed by actinomadura madurae, 12.9% of actinomadura pelleteri with 3.2%. For the figure 2, it shows that the classification of patients that are diagnosed with actinomycetoma, about 50% of the 31 patients had bone involvement, and the right leg was the commonly affected region in 38.7 cases. Meanwhile, 41.9% of the patients were represented by the farmers or agriculture workers. Figure 3 shows that the treatments used in the patients diagnosed with actinomycetoma, the 35.5% of cases were treated using Welsh regimen, the most commonly used treatment regimen. This regimen is a combination of trimethoprim/sulfamethoxalose, TMP/SMX plus amikacin. On the other hand, TMP/SMX plus amoxicillin/clavulanic acid was used for 19.4% of cases. Figure 4 shows the percentage of the effectiveness of the treatment used. The Welsh regimen was used for 35.5% of cases and had a 90% cure rate, while TMP/SMX plus amoxicillin/clavulanic acid had a 100%. Lastly, the figure 5 shows the percentage of the patients who received the treatment and were either completely cured or needed to follow up. Out of the 31 patients, 28 or 90.3% of it were completely cured, while 3 or 9.7% were lost to follow up. Based on the data presented above, N. brasiliensis with 83.9% was the most cause of lesions to patients diagnosed with actinomycetoma. The responses of the treatments used, which was Welsh regimen and TMP/SMX plus amoxicillin/clavulanic acid, had positive outcomes which led to 90% for Welsh regimen and 100% for TMP/SMX plus amoxicillin/clavulanic acid cure rate.
Thus, many patients' lesions are caused by Nocardia brasiliensis at 83.9%. It is followed by Actinomadura madurae at 12.9%. And then the least cause of lesions is Actinomadura pelleteri at 3.2%. In the result, it shows that 41.9% of the patients diagnosed with actinomycetoma are farmers, agriculture workers. Also, patients that had bone involvement diagnosed that the right leg was the most commonly affected part with 38.7% of cases, and there are 12% of other cases. However, there are treatments used for those patients who are infected and 35.5% corresponded that the treatment used is Wells regimen, a combination of trimethoprim and sulfamethoxazole, TMP and SMX plus amikacin had an effectiveness of 90%, but 19.4% of patients were treated by TMP, SMX plus amoxicillin clavulanic acid had an effectiveness rate of 100%. Moreover, 90.3% of patients who received the treatment were completely cured, but 9.7% were lost to follow-up, since mycetoma is a type of fungi found in soil. The ground research recommend that the farmers, agriculture workers must have footwear and avoid walking barefoot. Thus the germ can enter the wound of the small skin lesions of the body. Individuals need to have their proper hygiene, clean environment, and living conditions. Since patients treated by TMP, SMX plus amoxicillin clavulanic acid had an effectiveness rate of 100%, it is suggested that health professionals must give this drug as a treatment for mycetoma. However, it is recommended for the patients to have the treatment and give importance to it for total healing.